I'm here with Casper de Clercq, who is a partner at Norwest Venture Partners.
Yep.
So let's talk a little bit about the venture side of digital health. You made an interesting point as we were just speaking earlier that you think it's actually overinvested in at this point. Why don't you expound on that a little bit?
Sure. So in my mind, digital health started probably about 8 years ago, 2010 or so timeframe, and we invested in one of the first smartwatches that had continuous heart rate monitoring on it. And since then, we've seen obviously a huge influx of money coming into both from the venture capital world, but also from strategics, so pharmaceutical companies, medical device companies. I think it is a little bit overinvested in right now. I remain incredibly bullish about what's going to happen, though, just as what we've seen on the consumer front. Sort of, if you think about the dot-com crash in 2000, what came out of the ashes was a much better product and something that was primarily mobile. And I think we're going to see the same thing on digital health, that increasingly we're going to see mobile devices become the driver of all of our healthcare.
So what do you think that future kind of looks like? You know, we're still at the early stages right now, but where do you think we'll eventually get with the use of these kinds of technologies?
Yeah, it's interesting. I mean, I think there's sort of a couple phases, right? The first way that pharma might think about this, or healthcare generally thinks about filling in forms, you know? And so we made it more convenient to fill in forms. I don't think that's the end place we're going to be. We went from forms to then ambient sensing, sort of picking up stuff, and you see a lot with companies developing connected Bluetooth pens, you know, for injections, or connected activity monitoring, or blood pressure, or heart rate, things like that are of interest. I think really where we're going to be making big transformations is anticipating what patients need based on their daily activities. You know, we sort of think about medication reminders, but that's incredibly simplistic for what we could be doing based on what, you know, all the other things we've seen in life with respect to transportation, whether it's Uber, knowing where I'm going to go to work, or when I'm going home. Just anticipating those needs, and I think the same thing can be true for healthcare.
So as someone who is actively investing in many of these companies, what would you say are the most promising technologies out there right now that are actually already making a tangible difference when it comes to patients?
Yeah. So it's interesting. I think what I'm hoping for is companies like Novo or Sanofi, or, you know, folks in the diabetes industry, that they will have a big impact in simplifying the life of patients with diabetes. So connected blood glucose meter, connected to your pen, connected to your phone, or an insulin pump that knows exactly what your insulin dosage should be. That I think will be a big transformation. I think we're on the cusp of that. We've started a little bit smaller. You know, we've seen, I think the digital health is an iterative process. So unlike developing a drug where you have to go through the FDA once and you're done, this is much more a situation where you've got evolution and improvement, constant improvement in the feature set and the capabilities of the devices. So I'd say we've had a lot of success with a company called Omada, which has now treated hundreds of thousands of participants and has had millions of interactions, if not more, with every one of those members, and refining that and learning what works, what motivates people, what makes them more adherent, the messaging. Those are all things that can be improved dramatically. So I'm very bullish about those sorts of examples. I think there's actually a lot of opportunity as well just in using the watch from, you know, you've seen Apple come out with heart rate monitoring. We'll see. I don't think we know exactly what the applications are going to be yet, but increasingly, you know, you can do sleep tracking very accurately with heart rate, because it turns out when you're dreaming, your heart rate escalates. So things like that you would never have predicted are things that are actually very useful from a health perspective.
So let me ask the flip side of the question. Where is digital health way overhyped?
Interesting. I do think there's a lot of money that's gone into this field, and I think there are a lot of people trying to play catch up. And so, you know, whereas I think this needs to be a bit more organic on the venture side, to start small and iterate, like I was saying, I think it's a bad idea to be investing 30, 40, 50 million in what I call sort of these monolithic projects. I would say there's a underappreciation of how difficult it is to get people to engage.
Right.
And the assumption is that people will, just because it's there, they will come. I think it needs to be much more around actually evaluating and constantly improving what patients are using, what members are using the software for. So it's hard to be particular about any area that's been over-invested in, but as a whole, I think there's been way too much investment, assuming it's going to come early. And as I say, in healthcare, there are 4 stakeholders. You've got to make sure the patient is better, the physician's better off, the payer is better off, and also that the provider, the hospital system, and generally, and pharma would be another one. Everybody has to be better off. You can't expect patients to do all the work.